Trauma doesn't just fade away when the event ends. If you've experienced something deeply distressing, like an accident, abuse, disaster, or loss, your mind might still be processing it. Notice yourself having nightmares about the event? Avoiding certain places? Feeling constantly on edge or emotionally numb? These aren't signs of weakness. They're normal responses to abnormal situations. Trauma can reshape how we experience the world, but recognizing these symptoms is the first step toward healing. You don't have to face this alone. Reaching out to a mental health professional can help you process these experiences and find your way forward. Your trauma doesn't define you, but acknowledging it matters.
Managing PTSD. PTSD is treatable, and seeking appropriate care can expedite recovery and improvement. Although memories of the trauma may persist, you can learn to manage your reactions and reduce their intensity and frequency. Various treatment options may be beneficial. Psychotherapy. Confronting trauma with professional support can aid recovery. Different therapeutic approaches may be explored. Cognitive behavioral therapy, CBT, helps modify thought patterns that fuel anxiety. Exposure therapy involves confronting distressing memories or situations with a therapist's guidance. Cognitive processing therapy assists in processing emotions and challenging thought patterns about the trauma. Psychodynamic psychotherapy identifies current life triggers that evoke traumatic memories and exacerbate PTSD symptoms.
Eye movement desensitization and reprocessing, EMDR, involves processing trauma through guided eye movements, helping mitigate negative feelings associated with the memories. Couples and family therapy fosters understanding among family members and partners. Medication, SSRIs, and other medications can alleviate PTSD symptoms by reducing anxiety and depression, improving sleep, and managing other symptoms. Support groups. Led by mental health professionals, these provide a platform for sharing experiences with others who have faced similar trauma, facilitating emotional resolution and mutual support.
Support groups. Led by mental health professionals, these provide a platform for sharing experiences with others who have faced similar trauma, facilitating emotional resolution and mutual support. Understanding therapy. Therapy can be a vital step towards better mental health. Knowing what to expect makes the process more approachable. Each therapist and therapy type differs, but here are general expectations. Initial sessions. Your first meeting is often a consultation to assess compatibility with the therapist. Discuss your reasons for seeking therapy and your goals. If a therapist's approach doesn't suit you, it's okay to explore other options.
Therapy process. Set personal goals. Your therapist aids in identifying and achieving them. Share at your own pace. Trust builds over time. Therapy extends beyond discussing feelings. It involves challenging negative thoughts and behaviors. Homework may be given to reinforce learning and coping strategies. Long-term therapy. Many benefit from ongoing therapy, which may be combined with medication, support groups, or lifestyle changes for comprehensive care. Alternative self-help. Therapy isn't the only way to enhance mental health. Consider keeping a journal to process emotions, monitoring moods to identify patterns, engaging in physical activity to boost mood, eating healthily to support emotional well-being, taking breaks to manage stress, reaching out to trusted individuals for support, exploring self-help resources for additional guidance.
Improving therapy experience. If therapy hasn't worked in the past, consider trying a different therapist or approach. Be open about your feelings towards therapy, as therapists are prepared to meet you where you are emotionally. Understanding PTSD and CPTSD. PTSD and CPTSD have distinct origins and manifestations. PTSD typically arises from singular traumatic events, while CPTSD stems from prolonged trauma, often in childhood. Flashbacks, common in both, involve reliving trauma intensely and unexpectedly due to triggers. In CPTSD, emotional flashbacks are severe, overwhelming experiences tied to past abuse or neglect, characterized by intense shame, despair, or panic. Understanding these conditions lays the groundwork for exploring effective coping and healing strategies. Future discussions will delve deeper into managing emotional flashbacks and the role of self-criticism in perpetuating distress,